Hey guys, this is Dr. Ab. Today we'll look at the anterior dislocation of the shoulder and the tests which are involved. The first one will be the Bryant test. So what is the Bryant test? The Bryant test means the anterior axillary fold is at the lower level of the dislocated side. So the anterior axillary. So there is something known as the anterior axillary fold. So this fold, if you see, it is at the lower level of the dislocated side. It is on the lower level of the dislocated side. Then comes the presence of the Duca's test. So what is happening in the Duca's test? So in terms of the Duca's test, the patient is made to place the hand on the opposite shoulder. So you place the hand. So the hand is placed on the opposite shoulder, and the examiner then applies a gentle pressure on the flexed elbow. So the examiner, he applies pressure, and this is on the flexed elbow. And to make it touch to the chest, to touch it to the chest. And in case of the shoulder dislocation, the elbow cannot be made to touch the chest. So this is not possible in terms of the shoulder dislocation. So let's draw a rough diagram to understand it better. So the individual, what they do is, suppose the shoulder remains injured, the left shoulder, say it is injured. So you flex it and you place it on the opposite shoulder. So the arm is, so this will be the arm. So this arm is flexed and it is placed, and then the physician's hand is then used to compress this elbow to that of the chest. So if it is unable to compress, that means there is a shoulder dislocation. Next we move on to the Hamilton ruler test. So this is simple. So in terms of the Hamilton ruler test, it is nothing but a normal shoulder. And there is a ruler, that is a scale, which is placed on the lateral side of the arm. So ruler is placed on the lateral side. So it is on the lateral side of arm, and this will not touch the lateral condyle. So this does not touch the lateral condyle. So it does not touch the lateral condyle of the humerus and also the acromion. So it does not touch the lateral condyle of the humerus and the acromion, and this is of the same time. This is in terms of the same time. Next is in terms of the anterior shoulder dislocation. So in terms of the anterior shoulder dislocation, so here what is seen is that the ruler will simultaneously touch the lateral condyle of the humerus and the olecranon. So in anterior shoulder dislocation, the ruler, it will simultaneously touch, it touches the lateral condyle of the humerus, so lateral condyle, and this is of the humerus, as well as the acromion. So just to see a rough picture, so this will be the shoulder, the acromion will lie here, and the lateral epicondyle will be here. So both of them, it is going to, if you look at the ruler will be placed on the lateral side. So both of them will be aligned together. This is seen in case of the shoulder dislocation. Then lastly we look at the Coley's test, Calvé test. So in terms of the Calvé test, the vertical circumference of the axilla is increased. So the vertical circumference. So there is something known as the vertical circumference. So this vertical circumference of the axilla is increased on the dislocated side. So this is increased and this is on the dislocated side as compared to the normal side. Now this is the Calvé's. So in the Calvé's, the vertical circumference of the axilla is increased on the dislocated side as compared to the normal side. So you place a tape around the axilla region and then you measure the vertical circumference. To learn and grow daily like this, please do subscribe.